I'm one of three sisters and I'm the middle. Camilla, she's the eldest, she's the mother hen of us all, she's the one that keeps us in check. And then my younger sister is Annabelle. My mother was diagnosed with breast cancer when she was 56 years old. Following that, my father was diagnosed with duodenum cancer. And then I suppose the big one which hit me was a couple of years ago, my older sister, who I'm incredibly close to, was diagnosed with breast cancer at the age of 39. And my world fell apart. Hello. To me, cancer is something that sort of slightly older people get, not somebody under 40, and not somebody that I'm so close to, not a second time round. Camilla was advised by her doctors to say, listen, you should speak to your sisters and say they should get tested because this is happening more often than once in your family. There could be a genetic risk. So that's when I thought information is key here, information is power. On the other hand, I had my younger sister who wasn't ready to take the test. She was nervous of what she might be told. Naively, I wasn't expecting to be as high risk as he told me. It suddenly hit me like a brick wall, and that was my decision made. I never wanted to feel like that again. I never wanted to have that risk. They're coming off.
My name's Tina Walters and I'm a consultant breast surgeon. Charlotte came to see me after she'd seen a geneticist. One of the reasons that my patients trust me is because they know I'll do absolutely everything to make things right. I'll always tell them what my recommendation is. I'll say that these are the facts, this is what I think you should do. I think that by the time that Charlotte came to see me, she was fairly convinced about what she wanted to do. She'd already been through the issues, and I think that when somebody makes these decisions, that decision is very often coloured by the experience that they have seen their relative go through.
When you look at the genetic basis behind breast cancer, the first are the high-risk genes, BRCA1 and 2, then the intermediate risk genes like CHEK2, PALB2 and ATM. And then scattered across the genome, there are hundreds, thousands, tens of thousands of genetic sites that vary between individuals. And a lot of that variation actually predisposes to breast cancer.
Specifically for breast cancer, we're able to add in an additional over 80 different locations in the genome that are sort of hotspots that we look at, and we know that they are associated with elevated breast cancer risk. We also incorporate a patient's personal medical history and factors within that history that we know to increase risk.
Height, weight, age of first period, age of first birth, age of menopause if the woman's menopausal, details on breast biopsy findings, whether she uses alcohol or not, breast density from a mammogram, and a few other variables. And so all those variables get put together in a model that allows risk to be calculated.
I remember waking up from surgery and almost thinking, phew, this is over. That risk has gone. And to have that level of freedom and that weight lifted off your shoulders, it is seriously life-changing.
Having inherited it, you deal with it. You're not ashamed of it, you're open about it, you're active about it. And I think that's a wonderfully empowering symbol for the future as we start to wrestle with the possibilities of DNA, and we're just scratching the surface of this at the moment.
I think I won't have the full stop that you have as a result of your treatment because I did have the cancer.
On a personal level, I'm incredibly proud of the work that the field has done in understanding the genetic basis of breast cancer and bringing the tools that we've all worked on so hard for 20, 25 years to really make a difference to women's lives.
I'm looking forward now, and it is a life-changing position to be in. They looked at me as a whole person and my family history behind that, and by putting all of that information into the computer, into the pot. I was fortunate enough to get the result that I did to go and do what I needed to do. And that's why this test was fantastic for me.